Well, this is about preparing a consensus paper for diabetes in elderly group titled Principles of Non-Pharmacological Management of Elderly Diabetics. I propose the following tentative items to begin with as the contents of this consensus paper, and but I would only be dealing about the first part today, that is on comprehensive geriatric assessment for this presentation. However, the other items that I have tentatively proposed, they are all provisional, include self-care, diabetes education, handouts, compliance issues for elderly diabetes, and any other suggestions that may be arising from our esteemed members of the leader team and the other group members. So I look forward to those suggestions in order to complete the consensus paper in due course of time. So coming to uh, the current presentation about the consensus paper, that is uh, that is the first slide. Now, comprehensive geriatric assessment, that is CGA in brief, is a physical, cognitive, psychological, and socioeconomic assessment of elderly person and is a tool for early dementia detection too. CGA is simple, rapid, and can be used by any primary care provider who can refer to higher level if needed. This instrument can be administered in just 5 to 10 minutes. For an older diabetic, CGA can be used as an assessment tool of patient's ability for self-management of diabetes and therefore its prognosis and treatment outcome. Finally, the CGA is also useful in performing a patient-centered approach to improve his overall functioning and to individualize a treatment goal of HbA1c in elderly diabetics. Now, this is the first part of geriatric assessment, that is physical part. So we can test the vision by holding a Jagger card 14 inches away from the eyes. And if there is an inability to read greater than 20 by 40, the result is abnormal. For hearing, again very simple, whisper a short, easily answered question such as, what is your name in each ear while the examiner's face is out of direct view. And if the individual is unable to answer questions, even after removing the back, it is abnormal. For arm function, proximal and distal muscle function. For proximal, touch the back of your hand with hands like this. And for distal function, pick up the spoon. And if there is an inability or difficulty to do this task, this result is abnormal. For leg movement, observe the patient after asking, rise from your chair, walk 10 feet, return and sit down. If there is an inability in any part, it is abnormal. Physical assessment continues to find out if the person has any urinary incontinence by just asking a simple question, do you ever lose your urine and get wet? Answer could be yes or no. For nutrition, find out the BMI. If BMI is below normal or above normal, it is abnormal. For activities of daily living and instruments of activity of daily living known as ADL and IDL, you ask, can you get out of bed yourself? Can you dress yourself? Can you make your own meals? Can you do your own shopping? If the answer is no to any of these four questions, it is abnormal. For psychological assessment, there are two questions. For cognitive, I'm going to name three objects like pencil, truck, or book. I will ask you to repeat their names now and then again a few minutes from now. Inability to recall the name of these objects after 1 minute is abnormal. For depression, just ask one question. Do you often feel sad or depressed? If he says yes, it is abnormal. Lastly, the socioeconomic assessment is by the following parameters. Home environment. Do you have trouble with the stairs inside or outside of your home? And ask about any potential hazards inside the home, like bathtub, slippery floor, rugs, or bad lighting, and things like that. And if the answer is no, if the answer is yes, that means this is abnormal. Social support, who would be able to help you in case of illness or emergency? None is abnormal. Living arrangement, are you living completely alone? Yes, it is abnormal. Financial dependence, are you completely independent? If he says no, it is abnormal. If you find out his married status as widowed, it is abnormal. Yes. Family headship, if he says no, I'm no longer the head of the family, he says yes. And if he says yes to this question, it is abnormal. And for family position, are you loved and wanted by the family? And depending on the answer, it would be abnormal or normal. So this is how we find out if our elderly diabetes is marginalized or is independently living. So with that, I think I will come to the stop the share and I come to the end of this presentation. Thank you very much.